hear from our delegate, Delegate Kay Corey, about a public health release bill a little later on too. I want to take an opportunity to welcome everybody and go through the COVID-19 Justice Coalition's demands so we can just ground the conversation there. We started, and in fact, tonight we're going to go through a little bit of the history of this coalition and how we got started and some of the things that we've accomplished and some of the most recent advocacy efforts that we have been doing. But our demands are pretty simple. We want to release anyone in custody who does not pose a demonstrable imminent threat of harm to anyone else. We want to release those people as soon as possible, and we want statewide and local decision makers to hold themselves accountable and share that information daily with the public and be as transparent as possible about the process. We're going to hear tonight from Pastor Harvey Yoder, first Pastor Harvey Yoder and Nafisa Rice. So I'm going to introduce them in a second. But tonight we'll also be joined by Nicole Porter of the Sentencing Project. We'll be joined by Wanda Bertram of the Prison Policy Initiative, and then again, Delegate Kay Corey. So I'll kind of introduce folks before each section so you can get to know who they are before they're speaking. So we're going to get started with hearing from some stories. First with Nafisa Rice. She's the daughter of Jeffrey Davis, who is currently an inmate at the Buckingham Correctional Facility. And she's going to join us today to share her dad's story. And then we're going to hear from Pastor Yoder, who is a semi-retired licensed counselor at the Family Life Resource Center in Harrisonburg, Virginia, where he's worked for 32 years. He serves as the pastor of Family of Hope Mennonite House Church, and for over 20 years, prior to becoming a professional counselor, he taught social studies and religious courses at Eastern Mennonite High School, while also serving as the pastor of the Zion Mennonite Church. He's been an advocate for criminal justice for most of his adult life, and he corresponds with a number of people who are incarcerated in Virginia state prisons. You can also read some of his essays on prison, parole, and related topics by going to his blog that we can post later on in the program. So we're going to start with hearing from Nafisa. Nafisa, if you want to go ahead and share your story.
As is said in the bio, my name is Nafisa Rice. I am the daughter of Jeffrey Davis, who is an inmate at Buckingham Correctional Facility, who has been serving a total of 44 years. He was granted parole back on August the 26th. And from that standpoint, his release home plan was to come here with me and my mother, which is his wife, Bertha Davis, to Harrisburg, Pennsylvania. But there was a situation where my mother lived, and due to the nature of his charges, that he couldn't be there. So what we did was, and that took a process because the Virginia state had a 30-day, after 30 days of his parole, they had 30 days to get in contact with, I guess his parole officer had 30 days to get it here to Harrisburg. And then Harrisburg had another like 15 days or something like that in order to receive it or not. So that portion took a total of 45 days. So when his parole plan, which was his home plan, was denied here in Pennsylvania, it went back before the parole board, I'm guessing. The thing that I have a problem with is the lack of communication with the prison system as far as the councils and the probation officers that were handling the situation. So then from there, he set another, 20 some days before they took the initiative to try to help him find somewhere to be released. And then that took another portion. So altogether, he was supposed to, if everything went well, he was supposed to be released in September. But now he's being released, as you hear from Mr. Walker, the 20th. Is it the 20th, Mr. Walker, or the 22nd?
22nd, the 22nd.
the 22nd of December, because in the meantime of that, he ended up catching COVID. So it was one thing after another that's been holding up my father from being released. And he's a parole individual at this standpoint. So then he catches COVID. And then with the COVID, the jail system wanted to add people who were positive for COVID into their pods. And so then that became an issue. And then they said he had to wait. So altogether with this whole situation, it has been a damper on my father and our family, because we're planning for him to, come home. So in a total where he should have been released already, it took an additional almost 4 months.
We talk a lot about conditions of confinement and what it's like being inside, and then with it being just a petri dish for COVID, and which is one of the reasons we started Coalition. What was if you don't mind us asking, what was going through your mind, and what's the hardest thing for you right now with this long wait and everything?
The hardest thing with me is because, as you know, I am 36 years old. This would be the first time I'm able to see my father outside of the prison, system. I've had to talk to him like several times to get him to kind of like calm down, because he's anxious to leave. Of course, you're a free person at this point, and you're still being detained. Not by the will of your own, but because of just how the prison system works. I understand that things have to be decent and in order, but this situation just happened to each time they kept giving him a date that he was going to come home, and then they said, oh no, not that date, and then they gave him another date, and then they said no, not that date, then he caught COVID, and then after that it started to kind of go downhill. And my father kept complaining to them that, listen, I'm going to end up catching COVID, and it's going to be the reason why I'm not going to be released. And sure thing, he caught COVID, and that took an additional, I'm gonna say almost 3 weeks.
After he caught COVID, what was the process like? What was the were you notified, or
us? Say it again, ma'am.
What was it like after he caught it? Were you notified? Were you was information being shared with you, or
No. There was no information that was shared to me that he had caught COVID. I think the way that I found out was through the counselor. Yes, I called her, and I think her name is Miss Tony. And I spoke with her, and I said, what is the situation? And she was like, well, I can't tell you basically what's going on, because he has to share that information with you. And I said, well, he did tell me that they said that he has COVID. And that's when she went on to kind of said, please don't tell him that we're going to have to delay his time being released. And I did take the initiative, and I called the parole board, which is, I guess it's called the community release. I might be giving it another name, but it has something to do with that. And I spoke with the gentleman, I think his name was Tom something. And he let me know that, at the end of the day, no, the prison system did not have to put anyone who was who already tested positive in another pod with a person that's already trying to get over COVID. That was something that the institution took upon themselves to do. So that's where I felt that the injustice came into play, is because you as the institution, I understand that COVID's everywhere. I do understand that. You can't run from it. You can't hide from it. But why would you go and then in return take a person who's positive with COVID? Okay, we don't know what their symptoms or how long they have been going through it, but you're going to put them in the same pod with other people who are getting over the COVID. These people that might be coming in might be only 4 days in. These people are probably already 10 days in. So if you bring that person into the pod, and now these spores is everywhere, these people could end up going another 14 days, and it's just a consistent cycle of not being sanitary. So at that point, it was a hard thing on us because as the family, we're trying to keep my dad at a steady mind pace because, you know, he's already in prison. You're already confined. You want to come home. We're just trying to keep him enlightened and, you know, giving him good conversation, words of encouragement, praying for him from the telephone when we should actually be sitting in front of him at least by now. So you can go ahead.
Oh, I was going to ask, you know, one thing I forgot to mention at the beginning of this call or this meeting is that, you know, you'll notice on the screen there's a box that's reserved for Governor Northam, and that's because, you know, we sent him an invitation to come to this town hall to hear from family members of people who are currently behind bars, because we think it's a really important thing for him to know from people it's happening to. So if you could, you know, if Governor Northam had chosen to come tonight, what would you want him to know? What would you want to say? What's the most important thing that you want him to understand about what's going on right now?
I would absolutely want him to understand that a lot of these gentlemen who are incarcerated it's not just my father who's going through the situation, it's a multitude of them. And to not get the actual treatment that they need, because my mother just had COVID and she was hospitalized, and my aunt had pneumonia and a touch of COVID and they were hospitalized. So to me, these people that are being incarcerated with this virus is not getting the significant medical attention that they need. They're not. You're housed with other people who have it. Some people are sicker than most, but at the end of the day, they don't have I'm pretty sure they don't have the correct ventilation system in there. I mean, you know, the one guy told me when I talked to him at the parole office that they were actually trying to put men on mats into gyms and stuff like that, you know, instead of trying to, you know, eliminate the situation of the spread of COVID. But he's also have to look at the situation that these people do have families out here who are fighting for them and waiting for them to come out of prison. And some of these inmates, they have time that they got to do. My dad actually was a lifer, you know, and in this course, he was able to get parole. But look, he had to do 44 years of, you know, in the prison system, which he caught his time when he was a young man, not even what, I think he caught the charge 17. He ended up getting convicted and tried at 18. So can you imagine from 18 to 62 years old, you've been waiting for the day to walk out of prison for something you say, I did not do. And there has nothing been proven that he has did it. No DNA, no nothing. So could you imagine how he would feel to be stripped of your whole life and to go into prison? And then you have a daughter, which is me, and I am his biological daughter. You want to get out here to your family and start your life over and try to put back, you know, try to put that stuff aside, which it would never be, because now he's starting off at a senior citizen age to try to kind of like deal with life. You know, it's a hard thing, not only on him, but on me, because he missed my whole life. And we had to deal with from the prison walls and from a phone call. 44 years he's been incarcerated, and to sit another 4 months, you know, for something that you have no control over, and the lack of communication and the lack of, you know, awareness, that will make anybody, I'm surprised he didn't go off. I'm surprised he didn't do nothing extra, you know, and that's just the will of God for, you know, him and our family of prayer, you know, and it does change things. So if I had the chance to, you know, that would be what I would basically say to the governor. It's a lot of prison reform. You have a lot of people in there who are sitting doing time for stuff they didn't even do.
We appreciate you sharing your story, and I'm extremely grateful that your dad's getting out, and you know, we wish you the best, and he's very lucky to have you and that support. Not everybody has that. So we really appreciate you being here tonight. And we wish the governor was here to hear you say that. But, please feel free to stay on and listen and be here and contribute to the rest of the discussion as we keep talking tonight. We're going to talk to Pastor Yoder now, who has a couple other stories to share, folks who are currently serving and in this horrific pandemic inside and dealing with this. Do you want to go ahead and share?
Yeah, thanks for inviting me, giving me this opportunity. Let me give you an example of Charles Zellers, 52 years old, from Lunenburg County, who was charged with capital murder when he was 25 years old. And he has been in prison for 27 years. He took an Alford plea. There were conflicting testimony and very poor representation by his attorney that he was persuaded to take the Alford plea for fear that if if he were to have a jury trial, he might get, like indefinite life sentence or 2 life sentences or whatever, or even a death sentence. And so he took that plea, which he's regretted ever since. But he's been a model prisoner, as have been a number of people that I've been in correspondence with over the past decades, people inside prison who have done everything possible in terms of taking classes, maintaining an infraction-free record while in the system, so on. And of course, early this year, we saw the handwriting on the wall with COVID, and we're very avid in our support of trying to get as many people out of prison, which is really a potential hotbed for the spread of the disease, as we could. I was in the parole hearing for Mr. Zellers early this year. This was his 10th attempt to earn release for parole. And if anyone were worthy of that release, just based on their record inside the jail, inside prison, he would be a prime example and could be the poster child of the Department of Corrections actually correcting someone instead of just being a department of retribution about punishing people based on the seriousness of their crime. And that's the reason given almost invariably to people who are being turned down because of the crime they've committed, the seriousness of it, which is something they can do absolutely nothing about. But anyway, he was denied again. And then in June of this year, he contracted the virus at Buckingham Correctional Center, was sent to MCV, where he spent from early June to early September in intensive care for much of that time. Was on a respirator and very nearly lost his life. Was returned then to Buckingham for recuperation, and they realized that he was too sick for them to really give the care they needed. So he went to Southampton Memorial Hospital for rehab and was just released in the middle of September. I can hardly imagine the bill to the taxpayers for all of the medical care that he had to get because of his condition. And now he's still suffering the effects he has as a result of COVID, pulmonary fibrosis, which is a lung disease which is not curable and which could take his life within 3 to 5 years, unless there's some miracle. A second example, Jonathan White, who's been incarcerated for 39 years, has been turned down for parole 15 times. The most recent also just being within the past month. These are heartbreaking because these men, in both cases, they have taken all kinds of classes. They've been model prisoners have been, in fact, mentors for other prisoners. They are relied upon by the administration to help work with other younger offenders, etc. So they have this great record and great recommendations by people inside the prison, but the parole board just consistently turns them down. Jonathan White also has a pre-existing lung condition, and the COVID infection is just beginning to really spread at Augusta Correctional Center, and he, like many others, are living in constant fear that they could contract the virus and it could be fatal, as it has been in the case of, like, I think 36 prisoners so far in the state of Virginia. So I could give many examples, but those are just two that are especially close to my heart and with people with whom I've been correspondence for a long time.
Thank you for sharing that. And it is just, it's unbelievable and heartbreaking. And want to highlight that too, that parole was abolished in Virginia in 1995, and so many people don't even get the opportunity to be there, to be denied, but to be denied, so many times. I think we process like less than 2%, even of the folks that are actually eligible, which is small. But it's apparently based on, the severity of the offense. So no one can overcome that. How do you overcome that? Because you can't say, well, I've been this great person and all that, none of that is really there. So it's you had to have lots of examples. Are you experiencing this with most people? I would assume, since the numbers say that so few people are processed for parole or released, do you have any, is that a very common thing you see where people just don't, that's just is not happening?
Yeah, extremely common. And there's a lot of pushback. Our own state senator from my district has been on a campaign to try to abolish, to even restrict the parole board even further, saying that we should have people fulfill their sentences no matter what. In other words, the court has given a sentence, and other than the 15% time off for good time, that everyone should simply, in effect, he's saying parole should be abolished. And so he is on a campaign, and we've been in conversation frequently, but he's adamant in his position, as are many other lawmakers. And it's really hard. It's going to take, I think, from the grassroots, just people from, if no other reason, just from a standpoint of the cost itself, that we should be able to get a coalition of conservative taxpayers who are simply not wanting their taxes used to warehouse people year after year. And increasingly, these people who are parole eligible are eligible for geriatric parole as well. And so some correctional centers like Deerfield, for example, is almost like a nursing home. People who are blind and wheelchairs and using walkers, and the cost for their care keeps going up exponentially as they age. And so just as a taxpayer, I think it's outrageous. We can't afford to do this. And we are not adding to the safety of our communities by keeping people like that warehoused.
I wanted to ask almost a follow-up too to Nafisa about your dad and being that he did get parole, and it does happen so few times. Just did he get, was it something like related just to age, or that he is able to be released, and because the numbers are just work against us. Oh, you're on mute.
All right. Can you hear me now?
Yeah.
He was released on geriatric parole. My father went up for the first time my father went up for parole was in 1996 or 1997. At the time in 1995, as you were specifying, they did away with parole. Majority of the inmates who do a crime now, they don't get parole. I'm not sure, because I live in Pennsylvania, but from what I've read and what I've been told. So what happened was he went up for regular parole. And I told him to, appeal it. But in the meantime, we met with a jail advocate, and she told us to tell him to put in for his geriatric parole. My father has a couple health issues. He's a diabetic. And there's a couple other things that he has on, and considering the fact of his age. Now, you have to remember, he's been there since a teenager. He is 62 years old.
Wow.
You accidentally muted yourself, very sadly, right in the middle of that sentence.
Did I miss
When you
something?
think about those charges, you're like, they're very very serious and hindrance charges. But the way that they convict him was, just like the gentleman said, the pastor, he had faulty, representation. There was no DNA to prove otherwise, so they went off of what someone said. And I think he had to take a plea, because one charge he ended up beating, and the other one he ended up getting these 3 consecutive life sentences. So could you imagine, at 17 years old, being arrested, 18, and probably I think at 19, you're being handed down 3 consecutive life sentences for something you didn't do. This was just the pure will of God. I'm just going to tell you, it's just the pure will of God that he was able to get this parole. It was just the pure will of God. And I'm so thankful that, Virginia did granting him this parole.
A question I wanted to ask Harvey about, the 2 folks that you were talking about. Have you, I would have they applied for a conditional pardon? Are they in that process to try to get out through a pardon?
Yes, Mr. Zellers is working on that, but I must say, I think the prospects for that are very, very dim, just given the general climate of the system in Virginia. And Mr. White, he is doing an appeal of his last turn down on the basis that his prison record, he discovered just last year, he discovered that it contained almost none of the achievements that he had, the college courses that he took, in addition to all the courses in the prison system itself. And so they made their decision based on the chorus record, CORIS, I forget what the letters stand for, the record that is kept of each individual. So he's appealing on that basis. But again, just based on my years of disappointments after disappointments, I just hate to see people get their hopes up.
How long has Mr. Zeller been waiting for the conditional pardon?
He is just in the process of applying for it. So he hasn't actually officially waited yet.
Well, we really appreciate, well, actually, I want to ask you the same question before we move on at all, to discussion tonight about the kind of national high level, what's going on, and specifically more what's going on in Virginia with COVID-19 in our detention facilities. But since we have this seat reserved for Governor Northam, who's not here, Harvey, what would you say to him if he were here tonight that you feel like he needs to know about the situation and all the people that you're working with, and what would you want to tell him?
Well, I would just reiterate what I said a while ago. I think now is a good time, given the COVID crisis, given the budget pressures that are on the state government and government at all levels. I think this is an ideal time to try to work at getting a coalition of people together. Progressives on the one end who are saying that we are having sentences that are far too punitive and too long. In Germany, for example, a life sentence is 35 years. And we have, because of our system, we have way more incarcerated than any other civilized country in the world. And so if we can just, I think it would be possible to get a coalition of people together across the political spectrum, just from the sheer issue of cost alone. And are we getting the protection we are paying for, or are we needlessly warehousing people when we ought to be greenhousing them and preparing them for re-entry as soon as possible?
Thank you both for joining us. Please stay on, and I encourage you to be part of the conversation that we're about to have, and ask questions and participate, and feel free. So we're going to move on in the program and talk to Nicole Porter from the Sentencing Project and Wanda Bertram, who's joining us from the Prison Policy Initiative. So I'm just going to introduce both of y'all so folks that are watching can know a little bit more about your background. And we're going to talk more about the state of affairs for COVID-19 in our detention facilities at a national, 20,000 foot view, and then kind of narrow in on Virginia and see what the status is here and what's happening, and talk about vaccines and tons of stuff. And anything else y'all want to talk about that folks at home should know. So Nicole Porter manages the Sentencing Project's state and local advocacy efforts on sentencing reform, voting rights, and eliminating racial disparities in the criminal justice system. Her advocacy has supported criminal justice reforms in several states, including Kentucky, Missouri, and California. She was named a new civil rights leader by Essence Magazine for her work to eliminate mass incarceration. Since joining the Sentencing Project in 2009, Porter's work has been cited in major media outlets, including the New York Times, Washington Post, and NPR. She is also, I'm proud to say, a former director of the Texas ACLU's Prison and Jail Accountability Project, which mission was to monitor the conditions of confinement in state jails and prisons. So we're really excited to have Nicole with us tonight. Wanda Bertram is the communications strategist and spokesperson for the Prison Policy Initiative. She works mostly as a liaison to the press and the general public for PPI, but also helps develop the organization's reports that shine light on the cruelty of the criminal justice system. Both of these people have so many interesting articles and things out there that you can read if you Google their names, but we have them here tonight. So thank you both so much for joining the conversation tonight and being here with us. The first thing I wanted to ask really for both of you to kind of comment on is just from both of your lenses where you're looking at this from, and all the research and that your organizations do. Last week, COVID-19 cases in prisons were at their highest level since the start of the pandemic. Can you talk, not to give that away, but can you talk to us about, and maybe we'll start with Nicole, how we got here, where we are headed if nothing changes with the status of outbreaks and what we're doing in our detention facilities?
Sure. And thank you all for hosting this discussion. I know you've had a series of these. Thank you for including me. As the Director of Advocacy of the Sentencing Project, I focus specifically on state and local issues. And since the pandemic, have been, trying to work with advocates at the state level, but also at the federal level as part of a national conversation, pushing for the release of people from prison, given these are congregate settings, many of which are overcrowded. So people need to be released to the free community where they can avoid COVID or be treated for it if contracted, and then to better allow folks left behind to practice social distancing given the CDC guidelines. How we got here at the scale of incarceration where we are, and without any sort of real substantive release strategies across states, including Virginia, and then nationally at the federal level, is a politic that has allowed people to be disappeared behind prison walls and to have their care minimized and not prioritized, even in the midst of this public health crisis. It has been distressing to listen to developments related to COVID over the last week and vaccine, questions about distributing the vaccine, and not having people in prison prioritized as part of the conversation at all, which just reinforces the reality that there are 2.2 million people who are hidden from public policy conversations and that officials at the national level and within states can ignore, despite the fact that, Nafisa's comments earlier indicate that many of these people, if not all, have loved ones that have been left behind in spite their imprisonment or incarceration. And just because they are behind the walls does not mean that their humanity and dignity does not deserve to be acknowledged, and that their lives literally don't matter, and that they too should benefit from healthcare. They too should benefit from practices to avoid contracting this potentially deadly virus, and they too should be prioritized in terms of as part of an equity plan in delivering whatever prevention services are available, including the vaccines that are in the pipeline and are being distributed within states. I'll just say that there have been some modest releases, including in Virginia, but clearly there remains too many people who are locked up, who should have been released 9 months ago when the pandemic happened, because they're at risk of a deadly outcome of COVID if contracted, and many have served beyond any sort of functional purpose of their imprisonment because they've either aged out of incarceration, aged out of crime, aged into disability, and were sentenced to a too long prison term in the first place. There have been some releases. Virginia is among them. Other states include California, New York, a handful of places, and I know Wanda can speak to this as well. But it pales in comparison to what other countries have done in terms of downsizing their prison populations with the goal of reducing the harm associated with the virus. There are some countries like Turkey and Iran who release tens of thousands of individuals. So the releases in the United States by comparison are extremely modest. I would say that there's a national report that was released by the National Academies of Sciences that talks about prioritizing decarceration as a way to address the virus. So that national report is out there. And I think the next step around that report, and we can get into the specifics around this, is to pressure governors through the National Governors Association around using their authority to release people and help save lives in the midst of this continued pandemic. It's great that you have this seat literally available for Governor Northam. He should be here. And since he's not here, there needs to be efforts targeted to him. And there's a national conversation that I would love to continue to participate with you all on, targeted to the other governors around the country who similarly are absent and their leadership is surely lacking. from, doing meaningful efforts to decarcerate and help save people's lives and help implement the best practices that would allow the avoidance of the virus while this pandemic is still going on.
There's so much information in there that you just shared, especially the idea that there are other countries that are, America likes to like really pride themselves on being, I don't know, this like beacon of fairness and justice, and the idea that I mean, I think and too when you speak to the modest releases of Virginia, I think we're talking about like maybe hundreds. Like it's very, I mean, like very, very, very few people out of a very large system. Wanda, do you want to add to that, how we got here, where we are headed, from what you're seeing from your organization standpoint, specifically in Virginia and nationally?
Sure. Yeah. What Nicole said was awesome, and I don't want to try and even follow that, but just to to add a little bit more detail on the releases part, because you just asked a clarifying question about how many people have been released from Virginia prisons. There's a difference, I guess, between how much smaller a prison population is today than it was at the beginning of the pandemic, and the actual number of people who have literally been released for pandemic-related reasons. We've seen that the average state that we have data for at the Prison Policy Initiative, the average state has a prison population today that is about 15% smaller than it was at the beginning of the pandemic. And on the one hand, that is, those are prison population reductions that, normally we would really celebrate. But a lot of those reductions are coming from the sheer fact that prisons are just not accepting new admissions from county jails where people are sitting after having been sentenced, right? And in county jails, meanwhile, some states are shutting down jury trials, which means that people are being held pre-trial for even longer than they normally would be. So for the most part, the reduction in prison populations that we've seen is just because of shutting the front door to admissions coming in. It's not because of some wave of unprecedented policy on the back end. And by back end, I mean releases of people. I want to let you get back to your questions, but I wanted to spotlight something that Pastor Yoder said, because you were talking about, and actually Nafisa was talking about this too, the really callous treatment of people based on what their crime of conviction was. This is an issue that we write a lot about and we publish a lot of research on at PPI. But Virginia, if I'm not mistaken, was one of the states where the governor issued some guidance to the DOC saying, you should work to release some people from prison, but set so many criteria that it automatically excluded anybody with a violent offense and anybody who wasn't within a certain period of time for their release date. And that's something where it makes me so frustrated and so angry to hear that, because it's one thing to have a parole board or something. I know that parole doesn't exist for most folks in Virginia, but to have somebody review someone's case and say, this person is too dangerous for X, Y, or Z reason to be released. It's one thing to undergo that review. And it's quite another to say we're just automatically going to exclude this entire class of people from even being considered for release just because this label comes up in their paperwork. I'm a press liaison for the most part, as Jenny was saying when she introduced me. And one of the most common questions that I get from reporters on this issue is, well, our governor or our representative is saying that they're so slow in releasing people because they don't want to release anybody convicted of a violent crime who might might commit another crime when they're out. And, what do you say to that? And I'll just say, you should ask your governor, is there anybody in prison right now who you think shouldn't be there, who's still there? If not, I don't want to hear about the people who are too dangerous to release, who are the reason for you going slow, because it's hot air, in my opinion. What we're seeing right now is, these elected officials, many of whom were, talked such a big game about, the age of tough on crime being over and us living in a more enlightened time, the veil has been completely ripped off, and we're seeing them over and over again pass the buck on this issue. And rather than actually take action to get people released, which I know is difficult for some administrative reasons, just say, oh, I can't do anything. It's just too difficult, too dangerous. Can't do it. But go
I
for
was
it.
just gonna, yeah, Wanda, you're right on there. And these last 9 months have been such an example, a window into the lack of leadership in so many ways. Clearly at the national level, but within states, and just like the deflection of responsibility amongst people with any sort of authority, literally over people's lives. It's been an exercise in frustration watching this, and watching governors and legislatures not doing what they should be doing to help, reinforce public health practices for all residents, including residents who are incarcerated and in prison. And so, there's a great deal to be done, and many people who have aged out of crime, but who might have had a violent crime that they were imprisoned for, have aged out. And there's a national movement, national conversation around addressing these extreme sentences that dominate the national sentencing structure, including in Virginia. But, in these 9 months, if this crisis didn't create the space for releases, even with the criteria that some governors have implemented, then it just points to how much work there is to do and how much attention needs to be devoted to the people who, live at risk every day of contracting this, deadly virus in a congregate setting that they, can't avoid. They can't participate in social distancing with. So it's been an exercise in frustration watching this over the last 9 months. And I'm so grateful that you all have been doing these town halls, but it just really creates the need for urgency to figure out effective ways to share risk with governors and legislatures and parole board in Virginia in particular, so that people can be released and their lives can be saved.
Yeah. I have so many follow-up questions around the things that you guys are talking about. One of the things question that really keeps coming back to me, and it's something, Wanda said too, about you're closing the front door. Really, it hadn't even, I had not occurred to me the idea that, the releases are modest. And I think the coalition is aware of that. Virginia's released just a little over 800 people, and there's 26,000 people currently serving. But where are the biggest threats? Are y'all seeing trends of certain types of facilities that are, I know even in Virginia, this past special session, we just passed a bill to even have any transparency over, immigration detention facilities. And if there was any kind of, public health entity that was going to come in and even see what was going on. So are y'all seeing any trends of where the biggest threats are in different facilities that are out? It sounds like maybe county jails or these local jails where information is even harder, and even in Virginia, very scattered, different from county to city. But what are the biggest threats, and where are they right now for either of you?
Well, Nicole might know some more about this than I do. But from my perspective, what I've seen so far suggests that we really don't have enough data on jails to know how caseloads and fatalities in jails are stacking up, compared to prisons or to detention centers. Nicole, please correct me if you have different data. But like you're saying, normally jails are even bigger health risks than prisons because they are not built for long stays. Their facilities built theoretically for short stays where people end up staying for weeks, months, or even years, awaiting adjudication of their cases. So these are normally, really, really dangerous facilities. The only reason I would say they might be, relatively speaking, less dangerous right now is that at least at the outset of the pandemic, jails were able to reduce their populations pretty quickly, by more than prisons were able to. We saw at a certain point, the typical jail that we were tracking had cut its population by about 30%. And that's just because, again, most of these folks are being held pre-trial, and because in a lot of counties, well, I guess my personal view on this is that in places where, you know, in big cities especially, attorneys and sheriffs probably faced a little bit more of a public backlash if they continued to let a public health crisis go on right in people's backyards. So I think that plus the fact that most people were being held pre-trial allowed them to cut their populations a little bit more, which might mean that lower density in local jails has made those facilities less dangerous. Anyway, that's a really long way of saying I don't know. So I'm going to let Nicole take it up if she has any other things to add.
I mean, I think the reality is we don't know, and we probably won't get a full picture of this at the county jail level or at the state prison level until, you know, long after this pandemic is over, and perhaps there's some sort of, you know, truth and reconciliation process where we have true documentation of what we're going through right now. But I think while we're still in the middle of it, it's a little challenging to know exactly, you know, the true picture, to get a true sense of that. I think the reality is that these are congregate facilities, and just like the nursing home and long-term care facilities that dominate the news, the same issue is for those behind bars within state prisons, and also state and federal prisons, and also those within county jail. Now, I was on a call earlier today, another state coalition call, where, you know, family members were sharing that, you know, they're not testing people who clearly are showing symptoms. And so how can that state system know for certain whether, you know, how many people are truly positive, COVID positive, because they're not testing. And then if people show symptoms, rather than test, they quarantine them and might isolate them in solitary, or disappear them in a COVID wing. So no matter what the state numbers are in Virginia and probably, you know, other states, the number is probably higher than the reported or in the documented cases. And so that is something, you know, for us to reckon with, and to understand that, you know, long after the pandemic is over is probably when we'll have a true picture of what the magnitude of these last, you know, of this time has been and will be.
If I could speak to a local example here in the Shenandoah Valley, the Middle River Regional Jail, which some of our prisoners from our area are being sent to because of overcrowding in the Harrisonburg jail. They have over 200 cases of COVID as we speak. And we've been seeing the handwriting on the wall. There was not any consistency in how masks were worn by staff and personnel. And so they've got a terrible problem on their hands right now. And speaking, Wanda, of what you were saying about the fact that the state prisons are not accepting people from local jails, that facility alone, which currently has 900 and some inmates, we were, by the way, down to 700 and some due to some, you know, drastic measures that were being taken when COVID hit. But now we're back up to over 900. And part of the reason is that 300 of those inmates are waiting for being transferred to state prisons. And just as an aside, what makes this so maddening is that the Middle River Regional Jail is now proposing that we expand the jail to increase capacity instead of doing whatever we can to reduce the numbers in the first place. I don't know how it's been in your communities, but 25 years ago, our local jail held 75 people. And now the new facility that we built in 1995, we have over 500. No, we have 400 there, and the rest are being sent to Middle River. So in 25 years, we go from 75 prisoners to over 500 prisoners. And is our community, is your community that much more dangerous than it was 25 years ago? I don't think so.
Yeah, that's consistent in communities across the country. Let me just say that, because I know that Virginia is about to go into state session, so perhaps there will be political space to consider some, credible efforts to decarcerate. So number one is at the federal level, there, through the CARES Act, there might be resources available to incentivize decarceration in response to COVID. So I think one thing for this coalition to consider is how has that money come into Virginia? And is there some guidance that this coalition can offer to Northam and direct Northam's attention to? And two, any future considerations around federal funding, there might be a conversation for Virginia residents and advocates to have with your congressional delegation, and also directing attention to Northam's office. And then also the state that has adopted the most aggressive sort of statutory response to help decarcerate has been New Jersey, which adopted legislation a couple of weeks ago, signed by the governor, that resulted in the single largest decarceration of any state system. About 2,000 people were released from New Jersey in response to COVID-specific decarceration strategies that really moved up the release date for people within 9 months, who are already within 9 months of their release, given the urgency of the pandemic and the public health crisis. So there is political cover. I know, what happened in New Jersey may not carry a lot of weight in the Virginia and the Commonwealth Assembly, but just know that there are these credible efforts that have been adopted in other parts of the country, in addition to executive orders that can also be highlighted as part of a, targeted strategy to Northam in the legislature when it convenes next year. I wish you all luck. I'm so grateful that you all are having these conversations and keeping the pressure on. And I just hope that this can feed into a national conversation where there's amplification targeted to Northam and his colleagues within other states to really help people who are, at risk of contracting this deadly virus while it's still, creating this public health crisis.
And, I know the effort in New Jersey that you're talking about I think it was a combination of like an earned sentence credit bill that provided, it was kind of targeted toward, capturing a net of people that would actually provide substantive numbers of release. Could you talk a little bit more about that, like what that, and just generally, I think, strategies that state legislatures, we're going to hear a little bit about one tonight, but any strategies that state legislators are doing that are working?
Yeah, I'll add it, and Wanda would love to hear your comments too. But, specifically this bill that got adopted in New Jersey created, I suppose, in addition to any earned time or good time that was already possible under the state corrections code, public health emergency credit for adults or youth within 365 days of their scheduled release. So really allowed shortened terms, prison terms, given the context of the pandemic. So, there is some specifics about how folks were allowed to accrue those credits, but basically created another category of early release credits in addition to earned time and good time, the automatic good time credits. Also declared an emergency with a maximum of 244 days or 8 months following the completion of the pandemic. So these public health emergency credits could be earned even after the pandemic was declared over. So there are, very specific provisions that really allowed for the shortening, that have allowed for the shortening of prison terms, and that were immediately applied, which resulted in that single day release of a number of individuals who were eligible for early release under this policy. I'll say that because of that large scale release, community-based organizations in New Jersey came together and provided reentry support and other sort of community support for the hundreds, thousands of individuals released from state prison. And I also think that there is funding available through the CARES Act that could have been prioritized for reentry planning and home care planning. So those are dollars that should also be claimed by this coalition as a part of any plan to help decarcerate while COVID is still happening and long after, in support of reentry support for folks.
Wanda, do you want to weigh in there?
Yeah, I'd like to add on just a little bit to that. Although you did a great job just sort of summarizing what's in the New Jersey bill. There hasn't been any other state where I've seen kind of more effective legislation than in New Jersey. Although there are states where we've seen helpful action take place on other fronts. For example, I think that the governor that's taken the most action on commutations has been the Governor Stitt in Oklahoma. So a Republican governor, it merits saying, has taken more action than most Democratic governors that I've seen. So commutations is an avenue that there's only so much that you can get done through that, but I think that there is, at a time when there's so much leverage to put pressure on governors, that's absolutely something that state advocates should be doing. The other thing I wanted to highlight, and I'll put a link to it in the chat if anyone is curious to see it, is that there's a coalition of formerly incarcerated people and correction staff that came together in Indiana to put together a proposal for that state government to affect the safe release of thousands of people. So this was just a proposal. I don't think it got adopted, but I think that wasn't for lack of feasibility. It was for other reasons. The proposal goes into detail about things like, how can people be housed safely before their release, right? How do you quarantine people post-release without making the conditions carceral? How do you, what kinds of supports do people need when they're being released? I think that plan is really comprehensive and really good. So I'm just going to drop it in the chat for everyone and pass it back to Jenny.
Well, I was actually going to put a plug into that. If anybody that is listening on either Facebook or that is a member of the coalition here on the Zoom call we're on has any questions, you can drop them in the chat so that we can add them. But I did want to actually ask Wanda you a question specifically about a report that PPI published that was in all the states. I know you worked with the National ACLU on that, but Virginia got an F+ in this report, and I was just wondering if you could explain a little bit more about some of the criteria that you're looking for to give a good grade. What would have been a good grade for any state? Because I don't think anyone got above a D. If you could just talk a little bit more about that.
Absolutely. So our report with the ACLU, we put it out in June, and keep in mind, June we were still well into the pandemic. So that was the point at which we decided it's past time for states to have done something to kind of stem the impact of the virus behind bars. So we analyzed the measurable impact of the actions that states had taken when it came to the percent population reduction that states had achieved in their prisons, the population reduction they had achieved in their jails. We also looked at whether governors had issued executive orders, because we thought that central leadership is really important. And then we also looked at some of the smaller stuff, and by smaller stuff, it's potentially life-saving, but kind of the low-hanging fruit. And I'm referring now to testing, how prevalent testing is, and then how much the prison systems were providing PPE, so masks and other critical kind of supplies for people to protect themselves from viral spread. Virginia, like many other states, got in the F range. We didn't find many states that scored above an F. So there's really no state where I can say, oh, the state's doing a really good job. But the main reason that it scored so badly is that in June the prison population reduction was only about like 1 or 2%. And I think that that's still something that we wrote that report to last a long time. We intended for it to serve as sort of a historical marker for people to look back to when they wonder, okay, we know how many people were released by the end of the pandemic, but how many people were released, a few months into the pandemic? I think that the fact that most states scored so badly really points to, how long governors and departments of corrections dragged their feet. There's a couple other things that I could pull out from that report, but really the population reductions was the main thing that we looked at. So that's what I wanted to hit hardest.
Yeah. I remember getting that score and thinking that seems right. Based on what we're seeing. We want to take questions from the audience. At this point, I can also continue to, talk about all kinds of different questions with Nicole and Wanda. But if you have a question, please go ahead and put it in the chat and we can go ahead and try and get to it. I want to ask one more question, I think, about kind of the future a little bit. Vaccines are coming out more and more, and I think, I can't speak for anyone else here, but I feel like the concern is that, regardless of how vulnerable the population is behind bars, there is just a human dignity component that is missing. And so how, what is the, if you know of any, plan for providing vaccines to people who are incarcerated, or the status of that, or kind of what the national conversation is like right now about vaccines for people who are behind bars. That's for either of you.
Well, Wanda, I know that isn't PPI tracking the states that have prioritized. So yeah, why don't you?
Yeah, thank you. I was spacing out because I was answering a question in the chat box. Yeah, so we did a 50 state study last week, just looking at the statuses of different states' vaccination plans. It ended up being a 48 state study because Pennsylvania and Minnesota, for some reason, did not have plans available. On Virginia, like as far as Virginia goes, I had an interesting conversation with a reporter on that front. So the plan that we analyzed for Virginia made it look as though incarcerated people were in phase 2 of the virus distribution plan, but it was not super clear because like many other states, Virginia just kind of said critical populations and then just left it at that without any kind of specification of who fell into that group. In the conversation with the reporter that I had, who was doing a story based on our report, hang on a second, I'm seeing something in the chat box. I'll get back to that in a second. When I went to a reporter because of this, she said, well, I reached out to the Virginia Department of Health today, and they said that they didn't have a plan. And that's when I realized that we had been working off a draft plan, which I think is still kind of so I think the final plan for Virginia is still in development. So if you ask, what phase of the vaccine rollout are incarcerated people going to be in, my guess is probably phase 2, but it's also up in the air until the Department of Health releases a final plan. So kind of going more big picture, most states that we surveyed found that they had included incarcerated people and correction staff in their plans, but there were 10 states that did not include correction staff or incarcerated people in their plans at all. And in a lot of states, there were correction staff that were being prioritized to receive the virus, but incarcerated people were not being prioritized. And on the one hand, that makes a certain degree of sense, right? If correction staff are the individuals in the prisons who are having the most face-to-face contact with other individuals on a daily basis, and if they're coming and going from the prison every day, it makes sense that you'd want to vaccinate them first. On the other hand, this virus is coursing through prisons right now, and there are people who are elderly and people who have, pre-existing medical conditions where if they get the virus, it is likely that they will die. And so, the way that I see it, if a state is prioritizing people in nursing homes to get the virus, it should prioritize elderly people in prison to get the virus. If a state's prioritizing frontline workers to get the virus, it should prioritize incarcerated people, many of whom are doing critical work to support the running of the prison to get the, not to get the virus, to get the vaccine. So yeah, that's where we stand on that. And I'll throw a link to our vaccine study in the chat as well.
Here, here, Wanda. And I thought, the language that they were using publicly around prioritize, around vaccine equity, they were saying long-term care facilities, which, they weren't specifying nursing homes. I thought sort of the national rhetoric around it might give space to people who are in prison and jail. But, each state, the lack of national leadership has led to this disparity amongst states, and clearly there's a lot of weakness with the, amongst governors' offices and the like. I think one thing to act on that hopefully this Virginia coalition in collaboration with the national conversation is to target, again, I guess I'm just going to keep saying it, the National Governors Association around not just decarceration, but also delivering the vaccine. Also, I've been in a handful of conversations since the vaccine became a reality, and it's mixed in terms of whether or not people in prison want to take this vaccine. I think because of the history in the United States around medical experiments, and so I think there's a lot of discussion to have, but at the end of the day, people should be allowed to they should have the choice. And in prison people should be on the list of folks given these congregant lockup facilities that they're subjected to and that they have been disappeared to. So I'll just say that if there's any way to really escalate pressure around not just vaccine equity, but decarceration, the sentencing project is all in, and we want to figure out a way to really push this conversation to help get people out and then also prevent people from contracting this potentially deadly disease.
Thank you. All right, we're going to take a few questions that have come in from Facebook and from the Zoom chat. These are a little all over the place, but hopefully folks can just, if anyone feels like they're a better judge of answering this, go for it. This question says, is there a state board that oversees prisons, and are we looking at juvenile detention centers as well?
As far as juvenile facilities go, we're not looking at it. I know that there is an organization that is, but the name's escaping me. Nicole, do you know off the top of your head?
I don't, but youth, supporting youth in avoiding the vaccine and also as part of a decarceration strategy is also a priority. My colleague Josh has been tracking the rates of youth infections for youth who are detained, and the numbers are staggering. And really, any infection is too many. But no, I don't know of an agency that's doing that specifically.
Yeah, absolutely agree about the importance of looking at youth facilities right now. This is such a critical opportunity to push for decarceration for youth.
Yeah, I completely agree. I feel like I just saw a report actually. It might have been the Marshall Project. Might have also been the Sentencing Project. I'm not sure. that just got released on the status. And as far as the state board that oversees prisons in Virginia, there is not a lot of oversight. Don't believe there's a state board. There's the Virginia Department of Corrections, and that is technically overseen by the Secretary of Public Safety, Brian Moran, who was also invited to this town hall tonight and did not come, and Harold Clark, who I'm not sure his official title, but he is in charge of Virginia Department of Corrections. Another question. This one is a little bit, I don't know how to frame this, but I think this is about the idea of the election coming up and getting certified in January 20th and this kind of transition of power. But what happens if to folks who are incarcerated if there is some kind of martial law situation happening. If that's something that either of you have thoughts on, I don't know if that's in your wheelhouse or not, but.
That's
It's not in my wheelhouse.
No, you go for it, Nicole.
I mean, it's not in my wheelhouse at all. But I mean, perhaps those are questions that the that the Virginia ACLU has an answer to. I think it's the situation is that there's too many people who are incarcerated, too many people who are in prison. So the questions and comments raised today, if they could really inform an effective way to pass policies and implement practices that could get people out and support their reentry into the community, that would be key. And hopefully we won't go into martial law anytime soon. let's hope for that.
Wanda, did you want to add anything there?
No, I don't. It's outside of my wheelhouse too.
A little out of my wheelhouse as well, but it is something I think the ACLU had a lot of scenario planning for everything that we thought could potentially happen. A lot of it has not come to fruition, but I think as we get closer to January 20th, it is certainly a situation we're monitoring and are incredibly concerned with. And based on the treatment of people who are incarcerated just generally, I would be very scared for any situation is going to impact them worse.
Can I just jump in? The only sort of starting place for a martial law conversation is the preparedness around natural disasters. And there are people who put plans in place around that. So I don't know if Virginia has a plan in case there's a natural disaster that impacted its lockup facilities, but that might be a place to start in terms of what the plan could be for martial law. What is the evacuation plan if needed, and any other considerations around that. So maybe that's one sort of starting place to think about.
Yeah, I agree. Actually, one of the first, webinars I went to when the pandemic was even getting started was about learning from someone in Florida about what they do with local jails when hurricanes are coming, and how do they prepare for that. So there are a lot of similarities of just a public health crisis and an emergency of that magnitude. The last question is, how can testing be implemented for Department of Corrections staff? And if they're positive, how can you prevent them from reporting to work? The fear here is the staff are the ones that are responsible for transmitting the virus to those who are housed in DOC facilities.
I think this is kind of a contentious issue, right? Because I think there are some advocates who will want to leverage this situation and this opportunity to kind of to form partnerships with corrections staff and members of corrections unions who are who frankly are probably being victimized by the mismanagement of the pandemic, in a lot of ways, even as they also participate in the dehumanization of incarcerated people right now. I'm thinking specifically about states where folks, who work in prisons are forced to come to work, even if they might be sick, and are not provided with sick time off, right? If they're feeling like they might be unwell. I noticed when we released our report with the ACLU grading every state, that at that time, the Virginia DOC was not paying for testing for people that were working in the prison system. And that is unbelievable to me, that you would have frontline workers working for a state agency and not be paying for them to get tested. That puts so many people's lives at risk. So I don't know whether, I think it's up to the people who are working on the state level to make the call about whether, how much to leverage that issue. But I think that this is one area where, potentially the mismanagement of the virus and the cruelty that's being shown to incarcerated people actually overlaps with some mismanagement when it comes to the treatment of these workers, right? So that might present an opportunity. As far as how prisons should go about testing, for correction staff, I'm not an epidemiologist, but I mean, staff should be like, again, this is it's another reason to depopulate prisons and jails, is to, to make it so fewer staff are required to show up. That's going to be difficult in states where prisons are already crowded, but that's the line that we have been taking with this.
Yeah, and I know even in some states, they're working with correctional officers about, kind of lobbying them to because they are also concerned, or they, using them as almost like a constituency group that can be a positive force. Nicole, were you going to add anything to that? Okay. I'm going to ask. I did want to ask, there was something just to follow up on before we move on and kind of close out the program tonight and talk a little bit about a legislative effort that is happening here. Is something else that it's been kind of concerning through the pandemic is this uptick with the use of solitary confinement as a quarantining method. And just if y'all have any thoughts on that or any trends that you're seeing there around how much more we're using solitary confinement. And I'm really struck by even Nafisa's story of of her father contracting COVID, and then he's just sort of trapped in this facility. And so have you seen an upward trend in the use of solitary confinement?
Yes, and it's just, the reality of that is why there needs to be decarceration. And there are people in Virginia prisons today who don't need to be there, even if their crime of conviction was a violent one, period. And, the reality is that the politics, even in the midst of a pandemic, don't line up in a way that allows for releases of substantial numbers of incarcerated people, imprisoned people, so that social distancing can be implemented for those left behind without solitary, given the harms we know come through solitary confinement. It's frustrating and disheartening. I'm seeing the comments, in Facebook. So this period we're living through is one that just really sort of removes the veil on the problem of incarceration and imprisonment in the United States. And yes, the expansion of solitary as a public health response against this deadly virus for people who are in prison is just one indication of the failure and a sort of a collateral consequence related to mass imprisonment as well.
Yeah, I think I completely agree. I mean, there has been so much noise that's being made, for people on the outside about, how far is too far in terms of, forcing people to take steps to prevent the virus from spreading, citing the effects that it has on people's mental health. Well, the people who are facing the hardest, the most severe mental health strain right now are people who are in prison, who are in solitary or near solitary. And, I think one of the most shocking things is thinking about the price that the families of incarcerated people are paying right now to stay in touch with their loved ones while they're inside. There is no state that I know of that has taken some simple action to make communication free for the families of incarcerated people. And families go into debt, more than anybody can even say, when they have a loved one incarcerated. That's during normal times, right? In normal times, I think the figure is 1 in 3 families with an incarcerated loved one go into debt paying for things like phone calls and prison visits, while, telecom companies get rich off of those costs. During a pandemic, those costs are only going up. Unbelievably, at the beginning, I was seeing a lot of cheery, sugar-coated looking press releases from GTL, Securus, and the other major players in the prison telecom space saying, isn't it great that we've donated 3 free calls every month to people incarcerated in your state's facilities? And I wanted to say that is unbelievable. That's the number of additional calls that families are making dwarfs the number of free calls that companies are giving out right now. We've got private equity leaders who are getting richer and richer off of these costs right now, and states are not doing anything, not taking any action to make it easier on people. So, there are the impacts of being physically sequestered and solitary, during a pandemic, and then there's also the fiscal impacts that people's families are facing trying to stay in touch right now.
so many. I read something about the cost of prison phone calls is outrageous, and every state is different, and it's a racket. Thank you both for being here and sharing so much information with us tonight. It was so informative and helpful, and especially, I want to follow up with both of you to figure out how this coalition can work with you all to put pressure on the Democratic Governors Association, and just hear strategies from other states that we can copy here, and hopefully pass, including things like that, like things that should be maybe simple acts that could just increase communication, and make it easier, for people to communicate with their family members, especially now more than ever. I do want to ask if Delegate Corey is on the call somehow, and I just don't see her here. But I think there may have been something that's come up. So we want to talk a little bit about where this coalition has been, and over the last 9 months, and where we started, but also something that we're working on with the session that's coming up, that's going to start very quickly. We want to see if we can pass a decarceral bill. So I'm going to ask Jen Carter of the Humanization Project, who's a member of our coalition, to talk a little bit about the public health release bill, what it does, why it's important.
Sure, yeah, thanks, Jenny. So as Jenny said, I'm Jen Carter. I'm co-founder of the Humanization Project. I'm also a member of the steering committee for the coalition. And so I'm excited just to kind of give a rundown about what we did this year, because we've done a lot of things. And I think as advocates, it's so easy for all of us to kind of get a little frustrated when we're not seeing thousands of people being released. We're not seeing exactly what we want, but we really have gotten a lot accomplished. So our coalition was formed back in April. And as of now, I think we have almost 40 different organizations, 40 different advocacy organizations that have come together. We have meetings at least monthly. We have all sorts of working groups working on different things. And I'll just do a plug. If anybody wants to join the coalition, please reach out. We would love to have more organizations and even individuals. You can join as an individual as well. So yeah, please join us. But as I said, we formed in April. We initially had a press conference. We sent a letter to Governor Northam back then. We have been communicating and working with people behind bars and trying to amplify their voices. As the summer went on, of course, we got launched into the longest special legislative session, I think, that has ever happened. And so as we were headed into that, a working group was formed to draft some legislation and have legislative priorities for that session. One of those priorities was a bill that the Humanization Project had tried to put through back in January to expand our earned sentence credit system here in Virginia. So as we were discussing earlier, there's no parole in Virginia for anyone sentenced after 1995, but there is an earned sentence credit system. So if you do all these things right while you're behind bars, you can earn some time off of your sentence. And currently it's very, very minimal time in Virginia. It's 13%. And so the coalition backed that legislation as well, and it got through during special session, but in a very watered down way, as I think Wanda was talking about earlier, where they just immediately eliminated anybody with basically a violent conviction. So it got through, and it will help a lot of people, but it was watered down. But the other legislation that Jenny was asking us to talk about is this, what we're calling a public health release bill. And we, as a coalition, had it drafted prior to the special session, thinking this needs to be a priority during special session to help people be released because of this crisis. And what had happened here in Virginia that we've referenced earlier in this town hall was the governor put into effect a budget amendment in April that on the surface sounded really good. It sounded like anybody that had less than a year left on their sentence was gonna get a chance to be released. And then, as Wanda was saying earlier, there were just restrictions put on who could be eligible. And then on top of that, they put so much bureaucracy into actually getting people out the door that it really hasn't been effective. And so the legislation that was drafted by the coalition basically would take what was the intention of that, or the idea behind that, and put that into law. So this public health release would be triggered if the governor declares a state of emergency based on a public health threat. It would require DOC to actually calculate release dates quickly. Would require all sentences to be reduced by 3 months. And it would require the release of people determined to be particularly vulnerable to the disease, which could change depending on the disease, but always includes pregnant individuals and older individuals. Would require transparency of how many people are being released and require them to be supervised once they're released. So Delegate Corey, who we were hoping was going to be on the call tonight, she agreed to take it up. She couldn't get it even heard during special session, but she's having it put in for this upcoming session. So we're hopeful that that will happen in January. So yes, so then after that, we've done a lot of stuff. Let's see. After that, most recently, we have been sending out letters to legislators to ask them to go into facilities here in Virginia, different detention facilities, DOC, ICE, and local and regional facilities, and VCBR, which is the facility where they can continue to basically incarcerate people that were convicted of certain violent sex crimes even after they've served their sentence. So we've asked legislators to go in because in Virginia, as we were discussing earlier, there is no oversight for these facilities. There's absolutely no oversight for DOC. And one of the only ways we can see what's going on is to have a legislator use their right as a legislator to go into a facility. So we're asking them to do that. And then most recently on December 10th, we collaborated with the Virginia Redemption Project, who are working on conditional pardons and trying to get those pushed through. We collaborated with them on another letter to Governor Northam and to the legislators talking about those visits to detention facilities. But specifically for Governor Northam, we asked that he and Secretary Brian Moran, who's the Secretary of Public Health and Safety, meet with members of our coalition and the Virginia Redemption Project to discuss what more can be done to help people behind bars during this crisis. We asked that he release the number of conditional pardon petitions that they've received, the number that have been reviewed, and the number that have been granted during the crisis, and to release at least 1,000 petitioners by March 31st. We also asked the governor and Secretary Moran to join us for this virtual town hall tonight. And we also asked that they support the public health release bill that Delegate Corey is going to push through. So those were the things we asked of the governor in the letter. As we asked him to be here tonight, we followed up with a couple days after, and told him that we will hold this seat at all of our town halls going forward until he would like to come and join us and hear from advocates, and most importantly, from people behind bars. Each of our town halls has featured either letters or emails or words from people behind bars, as well as family members and folks that are working directly with people behind bars. So we really like to emphasize that and have that as the starting point each time for our town halls. Over the course of the year, we held 10 virtual town halls. We heard from a lot of people behind bars and family members, but we had many distinguished guests, including Delegates Foy, Cole, Corey, Scott, Hope, and Russell, Senators McClellan, Boysko, Morrissey, several Commonwealth attorneys and deputy Commonwealth attorneys, some other political candidates, and other folks from different coalitions. And to date, our virtual town halls altogether have had over 18,000 views on Facebook. So we're really happy that we're able to reach a lot of people through these, and we're really happy for everyone that was able to join us tonight. Before I do this, Jenny, did I forget anything important?
I don't think you did. I think you covered it all.
So I will say again, if you want to join the coalition, please reach out to us, and we'd love to have more folks in the coalition. Tonight, we do have a call to action, which I'm actually really, really excited about. Our Direct Action Committee put together a petition, and this petition is for as many people as possible to sign. It is intended to elevate and escalate the asks of the governor that we had in our letter from December 10th, and to also escalate the ask of the legislators to go into facilities here in Virginia. So I put it in the Zoom chat. I believe that Fong is going to put it in the Facebook chat. So please go and sign the petition. I think that would be really helpful, and we can see how many signatures we can get to help amplify these asks here in Virginia.
Thank you so much, Jen. Thank you to everybody that was on the panel tonight, to Wanda, Nicole, to Nafisa, to Pastor Yoder. We really, 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 really appreciate your time and your expertise and everything that you were able to share with us tonight. I know we're a little bit over, so I appreciate everyone that hung out a little bit longer to continue to hear about our petition and what this coalition has been able to do. I've been so proud of everything that we've been able to accomplish together, and we just got to keep working on it. Thanks everybody for joining us tonight.
Thanks so much for having us. Bye.
Thank you.